The new public health issue of housing access was investigated using a holistic, ecological, and salutogenic framework while considering the social justice involved. Access to housing is a determinant of health defined by the quality and location of a home. This includes the structure, home environment, community, and neighbourhood. Homelessness is also a significant public health issue caused by housing access. An individual or group which lacks the control or access to quality housing is defined as homeless. This definition or framework has been recently adjusted from rooflessness, as the quality and environment of a home is just as important as the structure itself. As seen in this table, 116,427 people fit the criteria for a form of homeless in 2016 in Australia. Extra data focuses on the homeless statistics for Queensland per 10,000 people. 46.1% are defined as homeless. Severe overcrowding is represented by people with inadequate control or access to space, resulting in 4 or more bedrooms required for comfortable living. Overcrowding population made up 60% of the homeless population under the age of 35 in 2016. Youth aged 12 to 24 made up 32% of the overcrowded living population. Clearly, people in younger age brackets are more likely to share housing. Housing costs accounts for 16% of homeowners' weekly income. On an average, this is $452 per week. These figures are similar for renters at 20%. The Red Lotus model is a health promotion model commonly used in the public health practice to evaluate a public health issue. This model allows for values and principles to be put into action and focus on 2 primary determinants, the individual and environmental determinants of health. Both will be used to investigate the health issue of housing access. A person's biological status includes age, ethnicity, genetics, and have an impact on housing access. Previously discussed data suggests that youth are more inclined to live in overcrowded housing. 32% of overcrowded living populations were aged between 12 to 24. As suggested by the ABS, ethnicity is also a determining factor of homelessness. In 2016, people born overseas and currently living in Australia accounted for 15% of the homeless population. This data can also be interpreted to say that people above the age of 24 born in Australia are least likely to experience homelessness in their lifetime. A person's genetic composition can also affect their access to housing. Certain genetic and disability can prevent people from working and maintaining stable income. Therefore, biological status is a determinant of health, which has a direct effect on an individual's access to housing. Socioeconomic status is a combined social and economic status of an individual. The socioeconomic determinants of homelessness include education, employment, and income. Education is a vital aspect of early life to gain basic life skills, personality development, and intelligence. In 2017, 79% of people aged 15 to 74 who had completed further education after school were currently employed. This data demonstrates that education leads to employment, opportunities, and stable income. From the data, we can assume homelessness is more of a risk when a low socioeconomic status is present. This implies that a protective factor of homelessness is having a high status. Socioeconomic status must be considered as a cycle where education, employment, and income are all connected and dependent on each other. Cognitive factors include a person's knowledge, attitudes, and behaviours, which are related to the issue of access to housing. Studies have revealed cognitive impairment occurs at an earlier age in homeless adults. Executive function in the brain is responsible for prioritising and organising and determination. These studies have shown that the homeless population struggle with executive function due to poor healthcare participation, alcohol, and substance abuse. This impairment will have a lifelong effect on trapped people in the poverty cycle. Therefore, homelessness and cognitive factors have a direct relationship, as homelessness causes cognitive impairment and executive function impairment. Physical and mental behavioural factors have an impact on housing access. Physical injury or disability can prevent a person from working. 1 in 5 people in Australia have a disability. Support systems aim to support disadvantaged people to provide a stable income as a form of social justice. In 2014, 3.4 million people identified having a mental illness or condition. Mental illness population are twice as likely to experience homelessness at some point in their life. This data identifies mental illness as a risk factor among homeless. A goal has been developed by the Australian Federal Government to halve the homeless rate by 2020 by offering supported accommodation. This goal states that the homeless will not be discharged from hospital without accommodation. This allows for environmental, physical, and mental health needs to be met. In contrast, studies also suggest that mental illness is a common result of homelessness. Therefore, there is a clear relationship between a person's physical and mental health in respect to housing access.
As stated previously, the Red Lotus model for health also focuses on environmental determinants. In this section, the environmental factors relating to housing access will be discussed. Environmental determinants represent the individual's natural, built, social, economic, and political environment. A person's natural setting refers to basic needs. These include food, air, water, noise control, and waste management. Being able to access these simple needs is essential to personal health and well-being. A study conducted on the homeless population of Australia stated that 84% of people ranked basic needs over housing and shelter. No further information related to the issue of housing access for the natural determinant was found. The built environment refers to physical infrastructure and urbanisation surrounding the individual's environment. Access to adequate living space is essential for comfort and quality living. A study completed in 2016 stated that 70% of Indigenous Australians and international residents were more likely to live in severely overcrowded homes. This can negatively affect the mental and physical health of the household. Quality of the household is imperative to maintaining healthy living. Household hardware refers to the physical features of the household. These include heating, cooling, plumbing, ventilation, cooking, and cleaning facilities. In 2006, it was noted that 4% of the population lived in poor quality households, with public renters, single parents, and Indigenous Australians being the more likely. This indicates how the built environmental determinants contribute to quality living. Social aspects of environmental determinants of health include social capital as well as the social and cultural structure. Social capital is broadly defined as one's social relationships within the community. In the subject of housing access, it is stated that those living in public housing exhibit lower levels of social capital. This in turn disadvantages the individuals and creates a barrier towards health services and health promotion. A lack of health education and services can lead to deterioration in health. With the Indigenous Australians and Torres Strait Islanders making up 9% of the homeless population, this states that they are more likely to reside in public housing and experience overcrowded living. The economic aspect of environmental determinants of health refers to wealth distribution and economic policies, both of which are equally important when regarding the topic of housing access. With 1 to 8 people in every 1,000 experiencing limited access to housing, a number of social policy objectives are present in regard to housing access. A range of housing policy programs were surveyed by the OECD to improve housing quality and affordability. These programs differ along numerous dimensions: their purpose, the tenancy they focus on, and their procedure of delivery. The political ideologies, policy, environment, and legislative environment are all part of the political aspect of the environmental health determinants. Individualist ideology would label homeless people as a social problem caused by and affecting normal people. However, a recent re-examination of this issue reinstates that homeless people are just everyday people that have had a stroke of bad luck. This manipulates the initial ideology and enabled the policy environment to revisit previous policies in place. Legislations have been created to provide better care and support for the homeless and those seeking adequate housing. In December 2008, The Road Home, a national approach to reducing homelessness, was released by the Australian National Government. This is so the homeless population have a greater access to appropriate health services, support systems and housing. A further 15 recommendations in regard to homelessness were investigated by Australian Government, with emphasis on social inclusion, human rights and access to adequate housing. The issue of housing access was investigated using the Red Lotus model. After analysis of the issue, it was found that all aspects of the model were affected by each other. Each determinant identified unique justification for the health issue of housing access. This framework identified specific groups most at risk of homelessness, along with the protecting and risk factors of homelessness.